HighBridge, a division of Recorded Books, presents American Diabetes Association Guide to Raising a Child with Diabetes, 3rd edition, by Jean Betschart Roemer, MN, MSN, CRNP, CDE. Read by Laura Copland. The suggestions and information contained in this publication are generally consistent with the clinical practice recommendations and other policies of the American Diabetes Association, but they do not represent the policy or position of the association or any of its boards or committees. Reasonable steps have been taken to ensure the accuracy of the information presented. However, the American Diabetes Association cannot ensure the safety or efficacy of any product or service described in this publication. Individuals are advised to consult a physician or other appropriate healthcare professional before undertaking any diet or exercise program, or taking any medication referred to in this publication. Professionals must use and apply their own professional judgment, experience, and training, and should not rely solely on the information contained in this publication before prescribing any diet, exercise, or medication. The American Diabetes Association, its officers, directors, employees, volunteers, and members, assumes no responsibility or liability for personal or other injury, loss, or damage that may result from the suggestions or information in this publication. Preface. Raising a child in today's world is a challenge all by itself. Our fast-paced lives leave little room to deal with normal childhood issues, let alone complex ones. If your child develops diabetes, adding the concerns of diabetes care to all the other tasks, obligations, and joys of parenting might cause you to feel overwhelmed. My purpose in writing this book is to provide you with reassurance and information so you can make wise decisions in the daily life and care of your child with diabetes. This book is for parents or those caring for a child with type 1 diabetes, although many of the developmental issues and treatments can also apply to the ever-growing population of type 2 diabetes in youth. A section on type 2 diabetes is included in this book and addresses the differences and special needs of the child with type 2 diabetes. I hope that you find the information and tools to deal with everyday situations as they arise, along with an understanding about how your child's age and development impact diabetes management. My goal is for you to become confident about your ability to raise a child with diabetes. The best diabetes care is somewhat structured, yet flexible and dynamic. Ideally, you will be able to fit diabetes care into the routines of everyday life, and yet modify it as your child grows and develops. Food preferences come and go. Children pick up different hobbies and sports. Your approach to diabetes care will need to change based on the needs of your child, the philosophy of your healthcare team, and your own parenting style. Help can come from many sources: loving friends and relatives, a strong, caring medical team, and the knowledge you gather as you learn as much as you possibly can about diabetes. As your child grows and changes, the way diabetes affects her life will change as well. Use the guidance here in conjunction with the advice of your healthcare providers. These are guidelines based on what experience and research have shown to be effective. Since insulin was first discovered, education has been a cornerstone of diabetes treatment. The more you and your child know about diabetes and how to treat it, the better equipped you will be to make wise decisions. There are many successful ways to treat diabetes. If you are currently doing something different from what is recommended here, it does not mean that one way is right or the other wrong. The right approach is the one that works best for your child and your family. Sometimes the only way of knowing which approach is best is to try several different strategies. I have alternated the use of he and she by chapters to avoid having to repeat the awkward he or she when referring to your child. Also, any mention of a brand name product does not imply endorsement of the product by the American Diabetes Association or myself. Brand names, when used, are only examples of the types of products available. Jean Betschart Roemer. Introduction. Research is moving forward to find a cure. Even though there is no cure for diabetes at this time, continuing advancements are making control easier. New and better kinds of insulin are available. Easy-to-use glucose meters make it possible for children to check their own blood glucose levels quickly and easily with very small amounts of blood. Syringes are more comfortable than ever. State-of-the-art insulin pumps and continuous glucose sensors are now available. The list goes on as technological advances are exploding. New knowledge gained from research tells us that diabetes treatment can be flexible, that rigid diets and schedules are not always necessary, and that diligence pays off in the treatment of diabetes and the prevention of future health problems. Diabetes should not keep your child from achieving her highest goals. There are Olympic athletes, professional football players, members of Congress, actors, and rock stars who live with diabetes. Some examples are Jay Cutler, NFL quarterback, Nick Jonas, Jonas Brothers, Joe Gibbs, former NFL coach, Halle Berry, actress, and Anne Rice, author. The good news is that you and your child can successfully adjust to life with diabetes. Diabetes affects many, but doesn't have to slow your child down or limit what they can do. Encourage your children to follow their dreams. When you learn that your child has diabetes, you might think that life has turned upside down. There is too much information to absorb when you are in emotional shock, and you don't know enough to ask the right questions. You need to grasp the basic concepts of high and low blood glucose, learn to give an injection to your child, and monitor and treat his low blood glucose levels. Parents report this period of time as being very stressful, especially when the diagnosis comes without warning. Parents often feel some responsibility and even some guilt over their child's development of diabetes. We tend to believe that good parenting means protecting your child from harm, keeping her safe. These efforts are intended to control the environment and prevent anything harmful from happening to our children. So when a child develops a chronic illness, you, as the provider and protector, probably feel as though you should have or could have done something to prevent it. You might feel helpless in the face of your child's illness. Accept that there was nothing you could have done to prevent the onset of your child's type 1 diabetes. You will need to find a firm footing, dig in, and make the best of things without feeling guilty. Even if you had known that your child was genetically at risk for diabetes, currently there is no known way of preventing the disease from occurring. Allow yourself time to be sad about the diagnosis. The disease will impact your life and the life of your child in many ways, and although it is treatable, and you should have every reason to be optimistic about your child's future, it is still a loss that needs to be grieved. Keep in mind that diabetes is manageable, and it doesn't have to keep you and your child from living life to the fullest. As you live with diabetes, you may also feel guilt about not keeping to a schedule, allowing your child to eat foods that are not the healthiest, being too firm about not allowing certain foods, and the pricks and finger sticks of daily management. Although these feelings are normal, allow yourself the luxury of the question, am I doing the best that I can under the circumstances? If the answer is yes, try not to obsess over it and move on. When you have a family, it is difficult to focus on one family member when there are others who also demand time and attention. Be forgiving of yourself. Call out your support team, or create one, and deal with it the best you can. Controlling diabetes can indeed be a challenge, because blood glucose levels can vary in spite of your best efforts. You can do everything right, follow all the instructions from your doctor, educator, and dietitian, and your child's blood glucose may still not be where you want it to be. On the other hand, things may go well when you least expect them to. This is frustrating and puzzling. Keeping records, trying different approaches, being a good problem solver, and maintaining some consistency of schedule in daily life can be helpful to understanding patterns. Learning as much as you can and keeping records will help you to make good decisions. Chapter 1. What is diabetes? Diabetes mellitus is not a new disease. It was around as early as 30 AD. Diabetes is a Greek word that means to run through. Mellitus is a Latin word that means honeyed. Healers coined this term to describe what they saw. People with diabetes urinated a lot, and their urine was sweet. Before the discovery of insulin, in 1922, children might live up to a year after diagnosis of diabetes and died of starvation or dehydration. At that time, people thought insulin was the cure, but we now know that not to be the case. Insulin is the treatment, and researchers are still working hard to find the cure. Despite recent progress in our understanding of the genetics and immune process of the disease, diabetes continues to increase by a rate of 3 to 5% per year. Diabetes in children. Diabetes is one of the most common chronic diseases in children. Type 1 diabetes is the third most common chronic disease of childhood, after asthma and cystic fibrosis. In the United States, there are approximately 216,000 children and teens under the age of 20 who have diabetes, type 1 or type 2. This represents 0.26% of all people in this age group. Estimates of undiagnosed diabetes are unavailable for this age group. Diabetes occurs when the body cannot use and store food properly due to a lack of insulin or inability to use the insulin being made. Insulin is a hormone made in the beta cells of the pancreas. It allows the body to use glucose for energy. Food is made up of protein, carbohydrate, and fats. When food is digested, it is broken down so that it can be used for energy. Proteins are broken down into amino acids. Carbohydrates become glucose. Fats become fatty acids. All of these particles enter your bloodstream and travel through the body to feed cells. Glucose is the body's main energy source, made from both carbohydrates and proteins. Before it can be used as energy, glucose must move inside the body's cells. Insulin is the key that allows glucose to move through the cell wall and enter the cell. In people with diabetes, either the body does not make enough, or any, insulin, or it cannot use the insulin available. In type 1 diabetes, the beta cells in the pancreas are destroyed and no longer produce insulin. So instead of entering the cells, glucose stays in the blood. The cells starve, and glucose levels in the blood rise. A high glucose level in the blood, also known as hyperglycemia, is a sign of diabetes. The two most common types of diabetes are type 1 and type 2 diabetes. In type 1 diabetes, the body doesn't make enough, or any, insulin. People with this type of diabetes depend on daily injections of insulin to survive. It is diagnosed more often in children and teens, but can be diagnosed well into adulthood. The onset of type 1 appears to be rapid. However, scientists have found that the development is a multi-year process. People who develop type 1 are born with a genetic risk of developing it. In type 2 diabetes, the body makes insulin but doesn't use it properly. Being overweight and inactive are risk factors in people who are genetically susceptible. The causes of type 2 diabetes are a combination of heredity, ethnic origin, excess weight, sedentary lifestyle, history of gestational diabetes, and giving birth to a baby over 9 pounds. Insulin resistance develops over time, leading to an inability to maintain normal blood glucose level. Many of the signs of high blood glucose are the same in both type 1 and type 2 diabetes. People with type 2 diabetes can often manage their diabetes by watching the quantity and type of food they eat, increasing exercise, and taking an oral medication. Often they also need to take medication such as insulin. Because children, teens, and adults in the United States and many other countries around the globe are fighting excess weight, in recent years there has been a tremendous upsurge in the number of children and teens diagnosed with type 2 diabetes. The pancreas. To understand type 1 diabetes, you need to know about the pancreas, a large gland located behind the stomach. The pancreas has two main jobs. It makes digestive juices and chemicals called enzymes that break down food for use as fuel. The pancreas also makes hormones that help to deliver fuel to cells. One of these hormones is insulin, which delivers glucose to cells. Clusters of cells in the pancreas are called the islets of Langerhans. The islets are made up of beta cells, which make insulin. Type 1 diabetes occurs when the beta cells are destroyed and can no longer make insulin. This process can be gradual or abrupt. Without insulin, the body cannot use glucose for energy. Insulin by injection or insulin pump replaces the missing insulin and allows the body to use glucose. Causes of type 1 diabetes. Type 1 diabetes is an autoimmune disease. An autoimmune illness is one where the body rejects and destroys its own cells, almost like having an allergy to yourself. The reasons why the beta cells stop making insulin are not well understood. However, it is known that the destruction is due to an autoimmune process. This means that antibodies are produced that destroy the beta cells that make insulin. Other types of autoimmune diseases include lupus, thyroid disease, multiple sclerosis, celiac disease, vitiligo, skin disease, and even a form of baldness. In these diseases, the body produces antibodies in response to a viral or environmental trigger, and these antibodies mistakenly attack and injure a part of the body. In the case of type 1 diabetes, the antibodies attack the insulin-making cells in the pancreas and eventually destroy them so that insulin is no longer made. These antibodies can be present for long periods of time before signs of diabetes appear. Scientists don't know exactly how a virus might lead to diabetes. However, they do know that some people inherit a higher risk for type 1 diabetes. Some families have more than one member with diabetes because family members share the genes that make them prone to diabetes. Current studies are looking at families to see if other family members have the antibodies and whether we can predict with greater certainty those who may go on to develop diabetes. Diabetes is also related to certain inherited genes. Genetic typing, DNA sequencing, suggests a high or low risk of developing type 1 diabetes. Genes alone do not seem to cause type 1 diabetes, but they do determine your risk of developing diabetes. It's possible that in people whose genes make them prone to diabetes, a virus or other stressor causes the antibody destruction that leads to diabetes. Other studies are investigating what starts the process in the first place, what can be done to protect the cells that make insulin, and why some people can have antibodies yet not have clinical signs of diabetes. Some people, especially children, worry that they can catch diabetes from contact with someone who has it. Diabetes is not contagious. It cannot be transmitted from one person to another. Many children who get diabetes do so shortly after having a viral illness. The peak months for the diagnosis of diabetes in children are September, January, and February, paralleling cold and flu season. The virus may have caused the autoimmune response, or the children may have been going to get diabetes anyway, and the viral illness brought it on quickly. Thousands of children get viral infections every year, and only a few of them get diabetes. Signs and symptoms of diabetes. The symptoms of diabetes are caused by blood glucose levels that are too high. Hyperglycemia. When the body stops making insulin and high blood glucose is not treated with insulin, a condition called ketoacidosis may develop. Ketoacidosis is a very serious condition and must be treated quickly by doctors and nurses experienced with diabetes in children. The symptoms associated with high blood glucose levels, or ketoacidosis, are often the first indication of diabetes. Experiencing these symptoms may be what brought you and your child to the doctor or hospital when your child was first diagnosed. Hyperglycemia, high blood glucose. Hyperglycemia is a high level of glucose in the blood and is a sign of uncontrolled diabetes. Here's what happens. After food is eaten, the digestive process breaks it down into glucose. Normally, insulin helps to move glucose from the blood into the body's cells. Insulin is like the doorman that opens the cell doors, letting the glucose in. People with type 1 diabetes don't make insulin, so glucose stays in their blood instead of entering the cells. People with type 2 diabetes often have a lot of insulin, but it is unable to enter the cells, so it cannot travel inside the cells and will remain in their blood. The cells then begin to starve, and glucose builds up in the blood. Blood glucose levels can go too high when your child 1. Gets too little insulin, too much food, or too little exercise. 2. Is under physical stress from a cold, sore throat, or other illness. And 3. Is feeling emotional stress. The human body is always working toward a state of balance. When there is an emergency state in one system, other systems go into action to help. When cells are starving, this is an emergency state. Untreated, hyperglycemia can lead to ketoacidosis. It's important to work with your healthcare provider to develop a plan to get and keep your blood glucose levels under control. When your child develops diabetes, she may have some or all of the signs that indicate her blood glucose level is too high. You will learn to recognize the signs and symptoms of hyperglycemia in your child. Ketoacidosis and diabetic coma. As the signs and symptoms of high blood glucose progress and worsen, the body literally begins to starve. Your child can slip into a state known as diabetic ketoacidosis, or DKA. This serious condition is an emergency and demands rapid treatment. Without insulin, glucose cannot enter the body's cells to provide energy. The cells are forced to burn fat to get the energy they need. When fat is burned, byproducts called ketones build up in the blood and spill into the urine. Symptoms of hyperglycemia. 1. Frequent urination. When your child has diabetes, high glucose in the blood spills into the urine, pulling water with it. This creates a large volume of urine and makes your child urinate a lot. You may not be aware of it during the day, but increased urination at night and bedwetting is often what captures a parent's attention. 2. Excessive thirst. As sugar and water are pulled into the urine, dehydration begins and thirst develops. You may notice that your child becomes extremely thirsty, drinking glass upon glass of liquids. If he is drinking sweetened liquids, it makes him even more thirsty. 3. Increased appetite. This is the body's way of asking for the food it needs to maintain weight and replace calories lost in urine. 4. Weight loss. Your child may lose weight because the body, unable to make proper use of food, tries to get nourishment by burning stored fat for energy. Weight loss also occurs due to dehydration because the body is losing so much water in urine. 5. Tiredness and weakness. Your child may feel tired and weak because the body's cells are dehydrated and starving. Muscle cramping may occur. Muscles and other tissues are depleted of glucose and water. And 6. Vision problems. Your child may complain of difficulty seeing the chalkboard or reading signs at a distance. High blood glucose can cause the lens of the eye to change shape, leading to blurred vision. This does not cause permanent eye damage and is not an eye complication. Once her blood glucose is under control, your child's vision should return to normal. Small amounts of ketones are probably not harmful. However, when ketones build up, they cause the blood to turn acidic, which can act like poison. A high level of ketones in the blood and urine is called ketoacidosis. The most common causes of ketoacidosis are 1. Undiagnosed or newly diagnosed diabetes, 2. Illness, and 3. Too little insulin to meet the body's needs. If left untreated, ketoacidosis can lead to a coma, brain swelling, and even death. With prompt treatment, children usually recover from ketoacidosis without any after effects at all. If your child did not have these signs and symptoms when she was initially diagnosed, the most likely time to see them would be during an illness, or if insulin has been omitted. Your child will appear quite ill as symptoms worsen and will need emergency care. Warning signs of ketoacidosis. Ketoacidosis usually does not develop without warning. The signs and symptoms of ketoacidosis are 1. Ketones in the urine and blood. 2. Dehydration. Symptoms include sunken eyes, dry, cracked lips, dry mouth, and skin that remains pinched up after it is pinched. 3. Nausea and vomiting. 4. Fruity-smelling breath. 5. Rapid or heavy breathing. 6. abdominal pain, and 7, extreme drowsiness. If your child develops any of these symptoms, it's extremely important to contact your doctor right away. Hypoglycemia, low blood glucose.
Sample complete. Ready to continue?